Hello and welcome to Lecture 4. We're going to talk about female anatomy today. While we do that, let's be thinking about Proverbs 18:15. The intelligent mind acquires knowledge, and the ear of the wise seeks knowledge. So I know that you are working hard on acquiring and seeking knowledge. So I'm going to help you out with female anatomy. When we look at this, um, this is kind of an understatement. The reproductive role of the female is more complex because of pregnancy. You think? Yeah, right. So when we look at female anatomy, of course, what are some things that are similar to males? What are things that are different? The gonads are called ovaries. They secrete estrogen and progesterone. They have internal genitalia. This is in the pelvic cavity, so the ovaries, the duct system, the uterus, the vagina, and then we also have external genitalia. Okay, so they're on the outside. And so when you look at this picture, you should be able to identify the ovary, the fimbriae, the infundibulum, the uterine tube, the uterus, the cervix, and the vagina. The cervix is more of an area, and we'll get into that a little bit later. But one other thing I want you to notice is the position of the uterus with respect to the rectum and respect to the urinary bladder. And so you can see that as the uterus grows with the baby, then the urinary bladder is going to get squished. And that's why poor mamas-to-be have to go to the bathroom all the time. Sometimes the rectum can get squished as well, and this can lead to periods of constipation. So be ye kind to pregnant women, okay? And we also look at this. Let's look at the external genitalia, often called the vulva. It really, the mons pubis is a pad of fat over the pubic bone, and it provides protection to the urinary bladder and the uterus. It also is there for storage of energy. The clitorius, okay, which is erectile tissue. The external urethral orifice, you see that, and then we see the greater vestibular gland or vestibular gland, the labium minus or minora, and the labium majus, also known as the labium majora. Kind of really depends on where you were taught. So as you look at these and you think about their anatomy and where they're located, so think about during a exam, the physician the gynecologist will slip a gloved finger up into the rectum and feel around, feeling for is the uterus a normal size? Does it have any lumps or bumps? And they can also feel the ovary. They'll press down on the abdomen and press through the rectum and try to feel the ovary to feel for lumps and bumps in there. Then the scraping from the pap smear comes from the cervix, the surface of the cervix. Okay. That's probably more information than the men wanted to know, but it's all God's creation. It's absolutely amazing the way He put us together. So the ovaries are about the size, they're almond shaped, about twice the size of an almond. They're held in place by ligaments. And these ligaments can be stretched during pregnancy and cause the ovaries to kind of fall out of place. That happens from time to time. But remember that there is a ligament called the broad ligament, and it is going to support the uterine tubes, the uterus, and the vagina. And we'll take a look at it. When we look at the ovary, and the mammalian ovaries are extremely similar, extremely similar. There's an outer covering, there's a surface epithelium. All of the follicles are going to be in the cortex, and in the medulla, then we're going to find the blood supply, the lymph vesicles, etc. And this picture shows you follicles at different stage of development, and we'll talk about that in a few minutes. We'll spend a lot more talking about that when we get into lecture 5. Blood supply, ovarian arteries, ovarian veins. There you go. Each ovary, as I said, is surrounded by the tunica albugina, and that is going to help protect the ovaries. So let's look at this picture, and let me point out some things to you as we look at the picture. Okay, notice the things in red. You have the uterine tubes, all right, the uterine tubes, the top or the fundus of the uterus, the lumen or the cavity of the uterus, and this is where the baby will grow. Here are the parts of the uterine tube, and the fimbriae are these finger-like projections that are going to undulate and pull the ovulated ova into the infundibulum, then into the ampulla, and into the uterine tube. If we look at the wall of the uterus, notice that there are 3 layers that you need to know: the endometrium, the myometrium, and the perimetrium. The endometrium is the inmost layer, and it is going to have 2 different layers, and we'll talk about those in a minute. The myometrium is made up of smooth muscle tissue, and then the perimetrium is going to be continuous with the peritoneum. When we look at the cervix, and what you notice over here about the cervix is that we're talking about the opening and the portions of the uterus that make up this area. Okay, it has a couple of other anatomical terms: the internal os, the external os. These are narrowings. Okay, then the cervical canal. And so when we talk about the cervix and we talk about a pap smear, note that its scraping is going to be taken from this area right here. And so that we look at those epithelial tissues. Okay, there's the body of the uterus. You can see that in the broad ligament, that's this big thing, in the broad ligament, you see where we have we're going to see the fallopian tubes, we're going to see the ovary, the ligaments. All this is contained, even the uterus, even the right under here, under body of uterus, you see the ureter. Even the ureter passes through this. And this is basically to hold things in place, Now, in the vagina is really a stretchy tube. And this is where the penis is going to be inserted, and it's going to deliver, okay, it's going to deliver the sperm near or right below the cervix. And this, what the cervix will do is it will, the lips, the external os, will reach down into the pool of sperm and suck it up. Literally. It will dip down in. There's a vacuum that forms by the myometriums, or the myometrium moving and contracting, and it will literally pull the sperm up into the cervical canal, and with the rhythmic motions of the myometrium, it's going to continue to propel the sperm into the cavity of the uterus. And then the sperm will find their way into to either uterine tube, and if there's an egg in there, it may very well fertilize it. You never know. You just pretend they do. So we've looked at the ovary. Let's look at the ovarian follicles. These are little bags, and inside the little bag is the oocyte, and it's going to have different cells inside there, granulosa cells and thecal, thecal cells. And each month, one, you hope just one, oocyte gets ejected, and that's called ovulation. Sometimes two. Tube system, okay, uterine tubes. I would not consider the uterus a tube as much as an organ. The vagina is definitely a tube, but I think mainly because the uterus has a hollowed center, they may consider it a tube. The uterine tubes or oviducts, I like uterine tube because it's attached. It's a tube that's attached to the uterus. Usually fertilization takes place in the uterine tube. Okay? We've already talked about the infundibulum, and the infundibulum has fimbriae, and these are finger-like. They're ciliated. Okay? We have the ampulla. Usually we are going to have fertilization occur there in the ampulla. All right. So, as I told you, the little ova gets extruded from the ovary. The uterine tube captures it. It sweeps it along the ciliated cells inside the uterine tube, sweep the egg down toward the uterus. There's also smooth muscle peristalsis. And then the non-ciliated cells of the uterine tube are going to provide nourishment. They're going to provide nutrients for a oocyte and the sperm if they're there. Okay. So here's a cadaver, and you're going, wow. Look at where the rectum is. Look at where the uterus is. Look at where the urinary bladder is. This gives you some ideas of what things look like. Now, two problems that can take place. Ectopic pregnancies. So the oocyte is fertilized either in the peritoneal cavity, not good, and it implants someplace in the peritoneal cavity, or it is fertilized and it implants in the uterine tube and begins to develop there. if it can cause major problems. And you notice it says with substantial bleeding, and oftentimes, long time ago, this would be a cause of death for women. Pelvic inflammatory disease is basically sexually transmitted infections that have moved up through the uterus, out into the peritoneum, through the uterine tubes, and have been established in the peritoneum itself. This can happen with syphilis, gonorrhea. Those are the two main infectious bacteria that cause this problem. And basically what happens is that if you catch it early and can treat it, then perhaps you may only have scar tissue, or scar tissue that leads to infertility. If it goes on long enough without being treated, then the ovaries, uterine tube, uterus, cervix all have to be removed, surgically removed, in order to save the woman's life. All right, the uterus, okay. The normal position is that it inclines forward, so anteverted, toward the front. A-N-T-E means front room, or toward the front. Retroverted is that it reclines backwards. And a lot of times a retroverted uterus is a problem as far as infertility is concerned. We have the body, the fundus, the isthmus, the cervix, the cervical canal. Okay, so think of the cervix as the neck. It projects into the vagina. Okay, the cervix has glands that secrete mucus, and the job of the mucus is to stop the sperm. Now, the mucus is going to be really thick, except around the time of ovulation, and the hormones in the woman's body at that time will trigger the cervical glands to slow down the production of mucus and to make it watery, very watery. Okay. A pap smear I've talked about. This is to help detect cervical cancer. And look at this. It affects 450,000 women worldwide each year, killing half. So this is not something to take lightly. When we look at this, cervical cancer is more common between 30 and 50, whereas breast cancer is more common after the age of 50. We look at what causes it. We know that HPV, human papillomavirus, can cause cervical cancer, and we now have a vaccine against several strains of human papillomavirus. I would recommend that you get that if you haven't. You can get other sexually transmitted infections. Once the infection causes a disease, then we call it a sexually transmitted disease. All right. Now it says pap smear is recommended every 3 years, age 21 to 30. I think if you're sexually active, you might want to get checked once a year. Every 3 years, 30 to 65, but include HPV. Once again, I think if you're sexually active and you're not in a monogamous relationship, maybe that testing needs to be a little bit more frequent. Your book will say every 3 years after 65, but once that you're not sexually active or have a hysterectomy, you don't need them anymore. You do need a gynecological exam just to make sure that you're healthy. There are other types of cancer besides cervical cancer, and so After a hysterectomy, the cervix is gone, so getting a pap smear may not be, that's scraping cervical tissue. But the physician may want to do a swab of the end of the tube into the vagina that's been closed up, just to make sure, especially if you're showing symptoms. It's just, it's really, listen to your gynecologist. Ladies, if you haven't had a gynecological exam and you're 20 to 21, you need to go get a baseline gynecological exam. Some other problems that can happen: prolapse of the uterus, and basically what happens is that the muscles and the ligaments get stretched and torn during childbirth, during pregnancies, especially with women who have had multiple pregnancies, and by multiple I mean 4 or more. And the uterus will fall through the opening of a vagina. It looks painful. A lot of times, though, they can go in and tack up your uterus. So, they just kind of go put it back in place, and some women just decide, take it out. All right, if you need to stretch again, go ahead. Draw a line. The uterus has the perimetrium, okay, the myometrium, and the endometrium. We've already talked about these. Remember that myo means muscle, and in this case it's smooth muscle. Endometrium is the mucosal lining, and this is where the fertilized ova is going to implant, and it'll stay there during development. So the endometrium has 2 layers, the stratum functionalis and the stratum basalis. If you want to say the functional layer and the basal layer, that's fine. The functional layer is the layer that's shed during menstruation. Okay, the basal layer is the layer that forms the new functional layer after menstruation. The functional layer is going to respond to ovarian hormones. And so here we have a figure of the endometrium, and you can see the epithelium, you can see the uterine glands, the smooth muscle, which is going to be what? The beginning of the myometrium. The functional layer, which is sloughed off during menses, and the basal layer. All right. So the uterine wall, we're talking about, it has a very high level of vascularization. So the uterine arteries come off from the internal iliacs, and once they reach the uterus, they're going to branch into the arcuate arteries in the myometrium, and then once we reach the endometrium, they become the radial arteries. Radial. So you need to know radial arteries are in the endometrium. The straight arteries are going to be found in the stratum basalis, or the basal layer, and the spiral arteries are found in the functional layer. The spiral arteries are going to arise during the proliferation stage, and if implantation does not take place, then they will degenerate and spasm. So the spiral arteries die, and that tissue that's full of blood dies, and it's sloughed off. Okay, it's sloughed off during menses. Spasms of the spiral arteries and also spasms of the myometrium help with the shedding during menses, but and also what we call cramps. And some women have a harder time with cramps than other women. If it interferes with your life, then you need to go see your gynecologist and get some help. So let's take a look at this picture. Please note, all right, the uterine glands, we're going to talk about those in a minute, the spiral arteries, okay, the straight arteries, the radial artery. So you should know that the radial arteries are in the myometrium, the straight arteries are in the functional layer, and the spiral arteries, the straight arteries are in the basal layer, and the spiral arteries are in the functional layer. And it's the spiral arteries that repeatedly grow and die, okay, regenerate and degenerate. The vagina is a tube. Notice it's about 3 to 4 inches in length. And remember that the average penis is 3 to 4 inches in length. Aha! Think God made those to go together? Think so. It's a tube. It's the birth canal. This is the way the menstrual flow gets out. Organ of copulation. Okay? The vagina does secrete fluids. They're acidic in the adult female. They're alkaline in adolescence. It takes a little while for the secretions to get to the adult pattern. The mucosa near the vagina opening forms a partition called the hymen. And the hymen is also known as the maiden's head. And this is what physicians looked for in prospective wife of the king or the emperor or whatever to make sure that she was a virgin. They looked for the hymen. There are other things that can rupture the hymen besides intercourse. It could different kinds of injuries, but that's what they were looking for. And then we have the vaginal fornix, which is the upper end of the vagina that surrounds the cervix. And so let's look here at the perineum of the female. So notice where the labia majora and the labia minora are located. Notice the opening of the urethra, the opening of the vagina, and the anus. And so what you see through here is why if you clean yourself after defecation, you're going to pull feces from the anus into the vagina and the urethra if you wipe back to front. That's why it's important to always wipe front to back, front to back. In this way, you'll help prevent urinary tract infections and vaginal infections. We're also take a look at what's called the vestibule. Okay, need to make sure that you teach your daughters how to clean properly. The clitoris, which remember is an erectile tissue, and then we see the opening of the greater vestibular glands. And we'll talk about those in just a minute. Okay, because the uterus tilts away from the vagina, remember it should point toward the front. If people are trying to do an abortion, they can puncture the posterior wall of the vagina causing massive hemorrhaging and peritonitis and eventually death. So, yeah, be careful. We've talked about the mons pubis. We've talked about the labia majora. We've talked about the labia minora, the vestibule, and so the greater vestibular glands. Okay, they're homologous to the bulbourethral glands in the male, and they release mucus for lubrication during copulation. And as I said before, the clitoris is going to be the erectile tissue. And then you have the bulbs of the vestibule. Okay, these engorge with blood during sexual stimulation. So here's the perineum again. Make sure you can identify what everything is. Okay, why is this not going forward? Here we go. All right. So once again, you can see the vestibular glands. Okay. The clitoris, the vagina, the urethra opening.